name's Lenora Sparks, and this is our group project for Adult 1. We have a patient who presented with left-sided heart failure with fluid volume excess, and we're going to be teaching that patient discharge planning for signs and symptoms, being aware of the signs and symptoms, and then prevention once she gets home. Hope you enjoy. So we need to do nursing report. Ms. Battle is being discharged. Okay. She's an African-American female, 84 years old, married, experiencing despair related to her onset of recent medical problems and her spouse's Alzheimer's. She presented a couple of days ago to the ED with shortness of breath, dyspnea, with and without exertion, sweating and using accessory muscles. She's gasping in the orthopnic position. She is currently on 4 liters of oxygen via nasal cannula, and she reports not only having to use her oxygen during the day, but also at night now. Her history is of hypertension, anemia, dementia, stroke, diabetes, hyperlipidemia, GERD, COPD. She has a pacemaker, renal failure, mitral regurgitation, and her ejection fraction is less than 25%. So the doctor said she was ready to go home today. She has a family member with her. Okay. So actually, I have some information over here already for you to give to her when you incorporate it in your teaching.
Okay, so we're just gonna do. Had you already done any teaching, or is there anything I need to focus, put emphasis on?
Well, I had gone over some of the signs and symptoms, diet, but her family member wasn't here, and she really needs her to be present and for you to do reinforcement.
I can do that.
All right, great.
Thank you.
Have a great shift.
You too. Have a good day. Come in. Good afternoon.
Good afternoon.
Hi. How are you doing, Miss Battle?
I'm good. How are you?
I'm well, thank you. My name is Anna. I'm going to be your nurse today.
Okay.
And you are?
I'm Erica, her daughter.
Nice to meet you, Erica. You're getting discharged today.
Yes.
You excited?
Yes.
All right, before we leave, we wanted to just make sure that you understand some things that way prevent you from coming back again. 3 things we wanted to focus on was teaching you the signs and symptoms of your fluid volume excess, because you know that's what made you brought you to the hospital to begin with, because you have your you came with fluid volume excess related to your heart failure. So we want to teach you recognizing the signs and symptoms. We also want to teach you things or interventions that you can do to help alleviate or prevent complications. And then finally, we want to teach you about diet. To begin with the signs and symptoms, some of the signs and symptoms that you may feel when you get fluid volume excess are you may feel that you're very short of breath and you can't catch your breath no matter what you do. Also, you may notice that, suddenly your rings become tight around your fingers that normally weren't tight before. Also, swelling, whether it's your legs or your feet or, in your pelvic area, as well as any kind of tight clothes. You put on your clothes and they just fit a little bit tighter than what they did before. Some things or interventions that you can do to alleviate or prevent it are positioning, such as if you become short of breath and you just can't catch your breath, just immediately sit up where you are, and if you have to lean over a table or something like that, you can do that. Other things are you can, of course, you need to take your medications on a schedule on time, and if you notice any changes or anything, always don't be afraid to call your doctor. As well as rest between activities. We want to conserve your energy. We don't want you to expend all of your energy at one time. So what that means is, as far as like when you wake up in the morning, go in the restroom, brush your teeth, wash your face or whatever, and then take a little rest. And then after you catch your breath and you rest for a little bit, then you get up, then you go eat breakfast. And then after you eat breakfast, you may sit around for a while, rest up again, and then go do your rest of your daily activities. And that way, we do that to space it out. So that way, instead of doing everything at once, you get tired and you just poop for the rest of the day. That way you have energy throughout the remainder of the day. As far as your diet, The American Heart Association puts a restriction of 2,000 milliliters in a 24-hour period. And roughly 2,000 milliliters equals about a 2-liter soda. So what this means, in one day, you can only drink this amount of fluids. And I know it's kind of hard to keep track with it. You're like, I drank this and then I drank that, and you forget. So I recommend to my patients that no matter how non-fashionable this may be, I recommend you take it with you. So if you go to a restaurant or you're going out to a family function or anything, take this bottle with you. And every time you drink something, you just take a pitcher or a cup or whatever amount you drink and you just pour it in here. Okay. You just keep pouring it. So that way you can visually see, okay, well, I've had this much, I can only have this much left.
Yeah, that's a good idea.
And that way you can evenly space it out, so you know, like, well, even though I'm thirsty, I need to stop right now because I only have this X amount of left. And so I'm going to give this to you. And then also, I have some informational brochures here for you. One thing that I want you to do, the best indicator of your fluid status, is to do a daily weight.
Yes, and the home health people told me to bring a scale.
Oh, okay.
The blood pressure cuff, and they said that you would show us how to
Definitely.
use these
This is very good. So here you have a scale, and what I would like for you to do is every morning when you wake up, I would like for you to weigh yourself, and I would like for you to have the same amount of clothing, as well as I would like for you to do it at the same time of the day. Okay. And to help you with that, here I'm going to have a guide for you, and it's already labeled for you. And you just open the book, you write down your time, and you write down your morning weight. So that way you get on the schedule, you get on the scale with what kind of clothing? How much clothing?
As less as possible.
And every day it should be how much?
The same.
The same amount of clothing. And so you get up in the morning, you write the date, and you also write your weight on there, so that way you keep this with you, so when you go to your doctor visits, you can give it to the doctor, and he can say, okay, well, how you're progressing. All right, and then next I have for you is I also have brochures about diet, because the thing about heart patients is sodium, salt.
Oh, okay.
Water like salt, salt like water. So wherever the salt is going, the water is going to follow. So if you're eating a lot of salt, the water, you're just going to retain all your fluids. You're not
That's
going
where the swelling comes from.
That's right. That's where the swelling comes from, and that's why I said we want you to monitor if rings get tight. We want you to monitor if you're noticing that your clothes and your pants are getting tighter, and we also would like for you to look at your feet, your ankles, your wrists, anything. And what I have here is a book that gives you recipes. It also has foods that are low in sodium, and also foods that we want you to avoid, and we don't want you to eat at all.
So what about my TV dinner?
As the patient remarked, so I can't have my frozen dinners? We see an example of the calories and sodium in one serving of a frozen entree. That's why paying attention to food labels is critical. Let's look at an example. This label is broken out to guide you through each category. One part of a heart-healthy diet is low sodium. Some patients are restricted even further to 4 or 2 grams only of sodium per day. Looking at the labels, like this one, can help you decide if a dish is right for you.
Now, TV dinners, we typically do not. We prefer you not to eat TV dinners simply because they have a lot of sodium in them.
Oh.
Yes.
And like I said earlier, if you have a lot of sodium in your body, you're going to retain a lot of fluids. And so, but it has plenty of recipes in here for you to follow, and foods that you might enjoy, or things that you can do together or prepare together, you know. And this is also for you as well. So I'm going to give you this one as well, and these two.
All right.
Now I notice that you have a blood pressure cuff there.
Yes. I'm gonna demonstrate because that
do.
little guy that came to the house, he was just running through it so fast.
Right.
So let me just make sure that we got a correct understanding. He said that this is one that you just put on your wrist and you press the button, and that's all you gotta do.
That's neat. Oh, and it also gives you a pulse, which is
Yes.
good because in this book that I gave you, this one right here, it also has a place for you to put your pulse as well as your blood pressure. So when you do your weights in the morning, go ahead and do that too.
Okay.
And that way you can put it right beside here. And like I said, when you go to the doctor's office, he gives you the book. He's going to be so proud of you. He really is. He's going to praise you. And that way he can see if your medications are working or if he needs to change anything in your treatment plan to better help you or assist you.
Okay.
So,
All
right, we talked about signs and symptoms. We talked about ways that you can alleviate and prevent any complications. And we also talked about diet. So, what are some signs and symptoms that you can retell me?
My rings getting tight, or my ankles swelling, or clothes getting tighter.
Right. Okay. What about what can you do to help prevent or alleviate any complications?
Keep on the low sodium in your diet.
Right.
So we have to watch what we eat. No canned foods or TV dinners, moms.
It space out my activities.
And why do we do that?
Because I won't exhaust all of my energy
There
at
you
one
go.
time.
That's right.
There you go. Do you have any questions, or is there anything that you would like to know where you're not quite sure about? Do you need some clarification on it, or?
No,
I think we have
I
it.
think we got it covered. And then we got the pamphlet with all the
Yes.
numbers and everything in case we, you know,
The
once
numbers are in there, so if you need any help, or you need your doctor's number, or we also have support groups in there because you also have diabetes and stuff like that, and so they have support groups with the numbers in here and the schedules, so that if you would like to go attend them, which I do encourage you to, for you to go do that.
All right.
So it's been a pleasure seeing you all today.
Thank
I
you.
hope not to see you in the future.
Okay.
I want you to stay well and stay out of here.
Thank
All right.
you.
But you have a wonderful day.
You too.
All right.
Nice meeting you.
You too. Thank you.
All right. Y'all have a good one.
You too.
And don't forget your soda
Oh,
bottle.
I got it.
When you have heart failure, your heart cannot pump enough blood to meet your body's needs. To compensate, your body retains water and salt, which increases the amount of blood in circulation. The heart beats faster, and your heart muscle gets bigger, causing your heart to wear out. The extra fluid buildup in your body, called congestion, and the overworked heart lead to congestive heart failure. Common symptoms of heart failure include shortness of breath, fatigue, coughing, and swelling due to buildup of fluids. As we just saw in the video, the complementary and complex problem of fluid volume excess and congestive heart failure is life-threatening. Our patient, Mrs. Battle, with her daughter's support, can manage her health and therefore her quality of life by adhering to the teaching Nurse Bailey verbalized and demonstrated. The key points were: limit sodium intake. Be aware of how much fluid you take in each day. Read food labels and eat a heart-healthy diet. Know your numbers, your blood pressure, and weigh yourself daily. Taking your medications as directed and daily exercise are also key in managing your health. Take care of your body, and it will take care of you.